Hey. We are here today with Senator Laura Acasio, who represents District 2 here and on the Big Island, and District 1, excuse me. In fact, what I'm going to do is just avoid putting my foot in my mouth and let the senator tell us all about what she does in her job. But first of all, just aloha, Senator Acasio, and mahalo for being here.
Aloha. Thank you so much for having me. Aloha, Danny. Nice to see you. And everyone who's joining, aloha to you today as well. So many may know that I was appointed by Governor Ige in January 2021. So I've been, for the past two sessions, nearly 2 years, have been working in the state Senate representing District 1 in Hilo. And so I'm actually I'm a member of the Human Services Committee in the Senate, as well as Hawaiian Affairs, Agriculture and the Environment, and Judiciary. So most bills and conversations related to, mental health or marriage and family therapy, counseling session, all of these topics will come through Human Services and or Judiciary very often. So this is a subject matter that I'm diving into deeper and deeper every year, and love to hear from advocates and experts in the field and learn more about the needs. And yeah, so grateful to be of service.
Oh, and so grateful that you are being of service. We had the honor of talking to your predecessor who had your position before, Congressman Kahele. We spoke with him on Monday. And he's a very sweet man, just so sincere. Really appreciated sharing some time with him. We had a few questions that we asked him, and they're all related to mental health. And I know you have been involved in some of the things that we asked him about. So maybe we could just follow up with you on some of the things that we've already kind of been working on this last session. And two specific things that I'm thinking of are the telehealth, the audio-only telehealth, and the associate level licensing.
Yes.
Yeah.
Very important. We worked on mutually. It was a beautiful coming together of many minds and like I said, advocacy and folks in the field who could give input as to what would be helpful in terms of expanding our access to mental health care. As a senator and a community member here in Hilo and talking story with people, the number one need that comes up is around mental health. Mental health, housing and homelessness, oftentimes those conversations come together in terms of making sure that we have access, and also for our youth. There's another something that comes up often is support services for youth that are feeling suicidal and even preventative measures prior to that. So in working with you folks, I did learn a lot, and that what came up was Senate Bill 2829. 2829, establishing additional licensure level of associate licensure for marriage and family therapists, so that we could expand the reach. The piece to our rural community, and I don't know that it's exclusive to rural community. I would imagine also it's in Honolulu as well, but I can speak to our island, is that access to medical care, access to mental health care is very difficult geographically. We have a huge island, and so we may have transportation issues, et cetera, to access. But then also what I'm hearing from providers is that the load is very full, and a human can only take so many clients. And so to be able to expand that underneath with these associate level licensing would be incredibly important for providing care, and also mentorship, right? So this dual thing where folks don't have to get a degree here and then go off to another state where they do have paid associate level licensure. They can, someone who's, so if we're growing our own and which is really also important for folks for us to grow our own, because we know the circumstances and the conditions and the socioeconomic, you know, diversity and different needs in our community. And also then we can have folks who enter into this kind of therapy and social work as providers that relate to the demographic that they want to serve, and vice versa, you know, these kinds of things. And so really reaching into that, and you know, so we push that forward. I am also, this happened to go through health committee. So I was at that time a little bit less connected with some of the details of and ins and outs of the politics around why it didn't move or why it did move. I do know just from my limited experience that sometimes these conversations are really important to have at least 1 or 2 years in a row to figure out where the unintended consequences are, or you know, taking into consideration all the different aspects. But I intend to continue the conversation on a larger scale this year. And again, each year going in, I come in with more experience, and I feel like that is an asset as well. So moving forward with that is really important. And I hear the need, and we definitely need to address it.
Yeah, I really appreciate you offering that. Learning that you described over the years is so important, because it is a process. The political process is very tricky. And like you said, to make sure that the unintended consequences are understood before passing anything. It reminds me of HB 1980, which is an audio-only telehealth bill that passed and is now on Governor Ige's veto list because of some unintended consequences of that bill. You know, it would likely reduce access. It would create barriers that don't currently exist around audio-only telehealth. And of course, that wasn't the intention of the bill. But that's what ended up happening. So yeah, with the associate level licensing, what I've heard, some of the pushback, and there was overwhelming support. There were only a few organizations that pushed back. One was an organization of psychiatrists, and their main pushback was it seemed like we were asking for an entirely independent group of providers to be created without a license. And that's not at all what that bill was. The associate level licensing bill might be a bit of a misnomer by name. It should be more like a training license or a provisional license, because it's always connected to, and it be written into the bill that is connected to a supervisor who is independently licensed, overseeing that person's work. And yeah, like you said, it would create mentorship opportunities, wonderful economic benefits to the entire community, reduce the brain drain. We won't lose our providers to other states. And particularly with all of the affordable housing issues that are going on right now, oh my gosh, we need to help our local people stay here.
Yeah, and on that piece, I would just like to say that moving forward, I think when you get the testimony in opposition, this is what I've found, or what we found in our office, and I think it's across the board, is really examining what that is and what the narrative is. And if it's not the case or what was intended, figuring out how to, a couple of things. One might be rewording it and really addressing what it's supposed to address. And the other piece is education. So it's the work now, which is before session, to be having meetings with folks and really explaining it so that it, and I don't think it's necessarily on purpose, but there can be a false narrative that goes around and gets out because of maybe not a detailed reading or a misinterpretation or these kinds of things. So then it becomes the job of all of us, essentially, collectively, to gather and to have educational sessions and really engage folks who are seeing it that way and try to understand why they're seeing it that way. Again, in a wonder and curiosity way, not in a combative way, right? Like looking at it and saying, oh, so that the clarification can be made, and so that the misinterpretation can be cleared up, whether it means changing the languaging or just addressing the issue and clarifying for those who think it has a different consequence. And so I think that's our work ultimately, in setting in motion between now and January, is to organize around that, and to reach out to those who have given testimony in opposition for various reasons, and to really dive into the details of explaining that.
Yeah, that's why I love that you're in office, because that approach, that collaborative, curious approach, is exactly what we need, not only here, but I think across this country. And as we're sort of, on this day, the celebration of the United States independence, there are a lot of different ways that we could look at that particular holiday. But I would say all of them, through the lens of collaboration and curiosity, will probably get us further along than any other approach.
Absolutely. Absolutely. Yeah. And then, okay, so then the other piece to growing the conversation and our need to move it forward is what other advocates are working on similar things. Like, I know oftentimes we have testimony coming from marriage and family therapy and from, psychology and groups that are working in that field and related, but what about folks working in our housing crisis? What about, and just trying to really reach out to, everyone is affected by mental health. So, we can look into advocacy groups for children and family, outside of just social work. And so that, again, the perspective that comes in and the support for and the recognition that there's a huge need for this, can reach out to even folks that advocate for early childhood development, or early childhood education, or, all related groups, but maybe periphery and tiers out, so to speak. And so just building that advocacy network. And I also think that in that collaboration, what happens is they're able to share what they're advocating for in the Senate or in the legislature, right? And so then there's opportunities to kind of cross-pollinate in terms of support. And I think that is really important as well. I mean, oftentimes we do need to put pressure on chairs to hear a bill for various reasons. And I think that's also fundamentally something to address, is the way that our Senate rules are set up, or even legislative rules, in that the chair has unilateral control of what bills are heard and not. And to really address that in ways that make that obsolete is really important. So, for example, we could do things, and there are many ideas in this. This is just part of making our democracy more transparent and more accessible and more egalitarian, essentially. It could be X amount of legislators sign on to a bill, it automatically gets a hearing, or, so many pieces of testimony and it gets a hearing. Because otherwise, we do enter into this arena of political theater where we go through this process, the entire legislative session, to hear testimony, and I don't think it's always nefarious. So I'm not necessarily saying that it's always intended, but we get to the end, and then without really much clarity to the public, bills die in conference, or they change drastically. And if they're changing drastically, it still may be subject matter. The subject matter may be the same, so it's not necessarily a gut and replace, but so drastic that those who have given testimony the entire session it's not testimony on that bill anymore, even though it's same subject matter. And so looking at some of these nuances in the process and how we can change it and make it more transparent is really important. And that really requires legislators who are willing to collaborate and aren't beholden to special interests ultimately.
And that sounds incredibly difficult because, you know, you got to have money in your campaign to be able to stay in office. But at the same time, I don't know, you tell me.
Or you do the work in your community and your community sees it and they check the box, because actually checking the box doesn't necessarily take money. But if you're purchasing votes because of a popularity contest, then yes, you absolutely need money, because advertising does take money. But, you know, building these relationships in the work we do is really important. Our community, especially here in Hilo, we talk. We know each other. If a good restaurant opens within a week, we know whether it's really good or not so good. And everyone's there if that's the case, if it's really good. And so there really shouldn't be any reason why, you know, if we really feel like this is important, spreading the word in our community for voters, it's free, ultimately. And so doing the work ultimately speaks for itself. And I think a lot of it goes back to trust. Not only trust in this in the civic process and really encouraging a community-based civic discourse around our needs of our community, as opposed to fear-based politics, pay to play, you know, large contributions and large expenditures in our campaigns. And so again, there's a whole movement in our legislature to get money out of politics, because ultimately the money does have a huge potential to corrupt. And again, not always, but huge potential. And we know it does. And so things like, so even this group, for example, we can advocate, it's just as important to advocate for this specific bill as it is for the anti-corruption legislation that will be coming forth, right? Not allowing campaign contributions during session, or, you know, putting a cap on how much each candidate could spend or raise in their election, and even carry over, because some folks, you know, they're able to acquire large donations over time and save it. And so then they have this huge war chest, right? They might have $1 million to spend. And there's no competing with that in terms of what kind of advertising they're able to reach compared to a newer legislator or a legislator who doesn't believe in that and only takes small donations that are not corporate with special interests. And so, you know, it's really about a lot of these anti-corruption approaches. There's a whole list now that we've you know, collectively pulled up that will be coming forth next session, and it's going to be a lot about anti-corruption. And so we take some of those out, and then, you know, bills that really address things in our community and our community needs have a fairer part of, they're fairer in the process, because maybe those we get representatives that are really desired by the community.
Yeah. Oh, that's such a refreshing perspective, and I really appreciate you bringing that forward. It doesn't take big donations to really build those connections and have people check that box because they trust you. And I know that's true in our Hilo town. I mean, I see your signs all over the place, and I see your husband handing out sweet potatoes all over the place. And, you know, it's like, you know, you got to love that family. Like, I trust that that family is going to look out for our community in Honolulu. Yeah. So
that's actually
Senator,
another. Just there are, you know, there's only 4 senators here on our island representing rural Hawaii Island. And so that's a piece too, is to make sure to bring that our island's perspective and our needs as opposed to Honolulu, because so many of the legislators are in, you know, an urban center, and there really are different needs, especially around healthcare. And so to really bring that voice in strong is very important.
100%. Yeah. And I'm wondering, what is it that you're focusing on in terms of mental health care? I know you've had some projects that you've been trying to work on. Anything in particular that you'd like to share?
So I would like to mahalo Governor Ige for not vetoing our other bill that I would mention. It's Senate Bill 2641, and it's appropriating funds for residential programs that allow it's alternatives to incarceration and programs that allow mothers and children to be together in that program. And I know there are some very successful alternatives to incarceration, or even like drug treatment programs that oftentimes mothers, they have barriers to coming forward to address their substance abuse issues, because there's large amount of fear that their children will be taken away. But here's a barrier to receiving help then. And so if there are more programs that allow children and families and mothers to stay together during a rehabilitation program or alternative to incarceration, then not only does it help to stop generational, incarceration moving forward, but the ability to stay together, because they're not always, we know that they're not always linked, right? You can have a substance abuse issue and you still love your child, and you want to do the best for your child. Obviously, it makes it more difficult if you're have substance abuse, but so making sure that they can stay together while the treatment is happening, and that it becomes a family project. And we have some very successful programs in that. So that was a bill that we introduced. It was part of the Women's Caucus. I was honored to introduce it, and it is going to be it was signed into law. So that's really special. Moving forward, we want to continue to do more of that, and expand the programs, and really look at our re-entry programs into community from incarceration, and work on permanent supportive housing and even temporary supportive housing to move into more permanent housing for our unsheltered population. That's something we've been working very collaboratively with the County of Hawaii and with Governor's Coordinator on Homelessness and many other advocacy groups and organizations within our community is addressing our housing issue. And so really looking at proactive solutions. Next week, we have an all-day intensive for leaders that is 100% geared towards finding, implementing and implementing solutions to homelessness in our community. So maybe we'll come out with legislation for that, but ultimately, I think we have a lot of the tools already. We just have to, again, it's the collaboration and the coming together and the delegating of, responsibility amongst the different organizations and stakeholders involved. So,
yeah. Oh,
big one. Yeah,
it's a huge one. And congratulations, and thank you for being so steadfast and successful in getting that bill passed. Wow.
that's my first bill.
All right. What an important win. Yeah.
More to come.
I believe it. Absolutely. 100%. Well, we've only got a few minutes left here, and just wanting to let everyone know, if you don't know, this is an election year. And so we really want to keep people like Senator Acasio in the process and really helping to move things forward. So as an organization of systemic and relational therapists, I would say Senator Acasio is about as systemic and relational as you're going to get without having an LMFT. So yeah, mahalo, Senator, for your efforts in the legislature, and really look forward to continuing to have some conversations with you going into 2023.
Yeah, thank you so much. Yes, please make sure I get invites, because being at the table is important. And if I'm for some reason personally not available, we will definitely send our staff, because we work, speaking of a system in our office, we definitely work as a group, and everyone brings their talents, and we pull it together also as a collaboration. So
Sure.
Definitely would like to continue to be at the table for the conversations, and so that we know exactly where we can help and where we can take leadership roles. A big part of it is really education and shifting the narrative. So let's keep doing that.
Keep doing that. Danny Gardner, any closing comments from you? Or
no, I think it's just been a really good experience to be involved with legislation. And we did meet with Senator Acasio, and she supported our bills. So it was a wonderful experience for me personally, because I come from a student perspective, and I'm learning from John. You know, I've learned a lot from John about the process, the organization, NFTs in Hawaii, and then the legislation piece is so important to me. So I appreciate you being here and collaborating with us, and I look forward to next year.
Yeah. On that note, we will wrap it up for today. Everyone, Senator Laura Acasio, I'm going to vote for, that's for sure. And we'll look forward to further conversations. So aloha, mahalo, hui ho.
Thank you, John. Thank you, Danny. Mahalo, everyone. Have a beautiful day.
You too.